Namaskar, friends. Good morning, California TV, CATV Global Medi Talk Show. And in the studio, we are having Dr. Pawan Gupta. Dr. Pawan Gupta is a director of surgical oncology from Max Institute of Cancer Care, Vishali, Patparganj, and Noida. Dr. Pawan Gupta holds a clinical experience of more than 25 years and he has conducted almost 11,000 surgeries, including 3,000 international patients. Welcome, doctor, in the studio.
Thank you so much. Glad to be here.
Do- Dr. Pawan Gupta is a founder director of Icon Care and Icon Care Academy. He is a master trainer and the convener of certified tobacco cessation courses, which are accredited by the Gujarat University. Dr. Pawan Gupta is the convener of Oral Oncology Connect Leader and Tobacco Marshal. He is also a president of I Can Care and I Can Win Foundation. Dr. Pawan is also an author of various books like Tobacco Cessation, a comprehensive guideline, Win Over Tobacco, Make Easy, Be Smart, Do Not Start, and Making an Institute Tobacco Free. He had also offered the guidelines. Dr. Pawan Gupta is the innovator of Triscare, the mouth opening device of Trismus Care. Congratulations, doctor, for this innovation. Dr. Pawan Gupta offers the campaign Save the Youth, Chota Dana, Knowing Tobacco,
Hi, good morning, everyone, and thank you, Dipti, for the kind introduction. And I'm really glad that you gave me an opportunity on this Medi Talk show at by the Global Healthcare, and I'm at California Television, America. And Dipti, basically, as you have introduced, I as a oncosurgeon, right? I am an oncosurgeon, and having working as the director with the Max Hospital and have been conducting a huge number of surgeries, mainly based on head and neck cancer surgeries. The problem, this head and neck cancer surgeries, as if you would know, Dipti, that India is the capital for oral cancers and head and neck cancers. Right? Besides that, the recent report has been there that India is becoming a very soon. India is becoming the capital for cancers. Right? We already have a lot of uh, chronic diseases, diabetes, hypertension. It is already there in almost like 1 in 3 are having diabetic, 1 in 6 are having uh, hypertension. And now we are almost coming to in the sense that 1 in out of 10 people are likely to have cancer in India. We need to understand what is the root cause for all these things. Until unless we take some real good steps to see that we reduce the cancers, and it is just not going to happen in one day. It is going to be years of work, and we have been already doing this work. And I started my organization in 2008 by the name of I Can Win Foundation, and we started working in the at the peripheries, in the village levels, in the rural areas, where we started educating people about cancer. The first and foremost, the fear was cancer is a killer. Cancer, we cannot it is very difficult for people to uh, survive after cancer. So the first, if you look at if you go back to the history almost like 10 years back, not even 10 years, 20, 25 years back, the major problem that we used to face was people getting aware about cancer, right? Cancer was supposed to be just a death sentence. It was a stigma, right? So getting that mindset out of the people, of course, it is still a challenge, but yes, we have done a quite amount of work to bring this stigma uh, out of the people's mind. So now, if earlier people used to hide if they had cancer, they used to hide. They will never come out of it. They will never come to the doctor. They will never come to the hospital. They would prefer to die rather than tell people that they have got cancer. But now, with this our campaign, that was our I Can Win Foundation, when we when we launched our campaign by the name of Win Over Cancer, right? The earlier the campaigns, and this is what I also presented when I went to Dublin in way back in 2000, I think 2009. I presented the concept change in the concept itself, that uh, cancer is not a killer. What kills is ignorance, right? And that is where we started working on that. And my concept was to win over cancer, make more cancer winners, right? Just fight against cancer. Fight is again a negative thing, but win over cancer is something that is important, and that is why we're working. Yes, we need to win over cancer, and win over cancer doesn't imply that all the cancer patients will leave or they will become immortal. But win over cancer is an attitude that yes, we can fight, and we are going to do more and more. At least we will be able to live happily whatever the remaining time that we have. And if you look at it, we have got a lot of changes have taken place over the treatment when we are treating these cancers, right? Earlier our fight was that how to at least control this cancer. It was like palliation was the major thing that we used to do in for our large of our cancer patients. That was what we used to do in palliation. But now it is not palliative. We are actually curing patients. And when we are talking about cancer, the number one most important thing is that I want to put it to everyone: cancer is curable when detected early. That when we detect it in stage 1 or stage 2, most of these cancers can be cured. So our initial work that we used to do in way back in 2008, and till I think almost like mid of the the next decade, it was like making people aware that cancer is not a killer. Cancer can be we can survive cancer. We can become a cancer winners. That was our major work. And then we started getting cancers at an early stage. So now screening program became something. Early detection became one of the most important aspect that we started working in, right? Early detection, catch them early was our slogan. Catch them early, right? Catch them early, like early detection, catching the patients in stage 1, stage 2, maybe in stage 3 cancers also. Now you will see that is a general awareness, even amongst the doctors, even amongst the patients, even amongst the public, that yes, if they have cancer, they immediately go to the doctors. Cancer patients, earlier there was hardly any facilities, but now, since the facilities are available, now the two aspects that we need to understand: the facilities for treating cancer is one part. There is another important aspect that we need to also consider: facilities for early detection, right? If you have a symptom, if you are at a high risk, if you are, then it may be important that we ask the patients to reach out to the such facilities for at least early detection. So there has been a change from patients coming at stage 4 and uncurable, where the palliation was the major first work that we used to do. Now the early detection has come on, and even more, now we are focusing on prevention. So I think these are the some areas which I wanted to cover up. I think over to Dipti.
Yeah. Thank you, doctor. You have guided us very well about what is head and neck cancer, what are the various prognosis, treatment, preventions available, and how you are running this I Can Care Foundation. Doctor, your surgical portfolio of head and neck cancer, thyroid cancers, parathyroid, parotid and salivary glands. Also, you are doing breast, esophagus, lungs, and thoracic reconstruction. You have revitalized the facial scarless surgeries and conducted 3D planning and reconstruction for head and neck cancer. Patients with a functional as well as cosmetic outcome that makes the patient live with the dignity and respect. First, I would like to understand that why you have opted the head and neck cancer surgeries only, and why do you think to become a doctor?
Oh, that was a wonderful say, Dipti. I chose to become a doctor. That was just a circumstances. I think I never wanted to be a doctor, but somehow I became a doctor. Whatever the reason, I'll not get in deep into it. But yes, once I became a doctor, I came to understand that, look, this is my calling. And as you said, if you look at in India, the see, I am a surgical oncologist. I can do all types of cancer. I used to do all types of cancer, but recently I started focusing more on head and neck cancers. From 2015 onwards, I started focusing on more of head and neck cancers. The main reason for this thing is that number one, head and neck cancer patients are huge number in India. We are getting all varieties of head and neck cancers, and head and neck cancer is a quite a big area. Like if you are looking, although if you look at the percentage in the body, it is a small, but the number of cancer patients that we see, we are looking at the oral cancer, the throat cancer, the thyroid, parathyroid, parotid, all the salivary gland cancer. It's a huge number of cancers that we see, right? And more importantly, most of these head and neck cancers, if you look at Indian context, then oral cancers are the highest amongst all the head and neck cancers. And these oral cancer patients are really doomed. And this oral cancer has got three important features. Three important features. Number one, it is easily detectable. It is easily detectable. Oral cancers just open the mouth and you can detect the cancer. You can see the cancer. You can see the lesions that is there inside, and you can easily detect the cancer. Number one. Number two, it is curable cancers. If it is detected early, if it is treated properly, it is a curable cancers. Number three, it is a preventable cancers. That is a very important aspect that I want to put it. It is preventable cancer. So three important: it is curable, it is easily detectable, and it is curable, and it is preventable cancer. And we know that the cause of this cancer is tobacco. So if I'm looking at cure, early detection is definitely going to cure. But for early detection, we need a lot of technology. We need to reach out to the people. We need to reach out to the to almost all the entire population, so that we can ask them to screen themselves. So that is where we started one uh, program also, where that is for the rural peoples and everything. We started one slogan also, like chota dana slogan. That is why we started working in the villages. छोटा दाना जब भी देखो छोटा दाना उसकी जांच जरूर करवाना कैंसर को बनने ना दो नासूर जल्द करो इसे दूर so please examine your oral cavity at least once a month. If you see any lesion, then please get it examined by the doctor. So prevention is another area that we started, that is that tobacco being the real cause. So we started working on the prevention aspect. And I worked specifically not only for creating awareness, but also helping people to quit tobacco. Right. So that is the area. And so this became like a entire, like a my not only just passion, but also a mission that yes, this is something that we need to do for the society. Thank you, Dipti.
Thank you, doctor, for guiding us. Now, I just want to understand what are your awards and recognitions that you are getting from various institutions, various NGOs, and various hospitals.
See, the greatest reward that I get is when my patients come back and tell me, "Oh, doctor, you have done a wonderful job." today morning I got a message from one of my patients whom I had operated in 2001. She's a teacher, and she messaged me that, doctor, what you have done for me is just unbelievable. And she had a very huge tumor of the tongue, which we had operated on her. She's a teacher, and now she continues to teach after the reconstruction. That is the biggest award that I get from when a person comes in and gives me a smile and says that, "Oh, doctor, you have done something good for me." That's it. That's the biggest award. Of course, the other physical awards. Just recently, I was given the Pathfinder Award. Then I have been given AIGES Award and ICD Award, and the RPOP Award, the Rashtra so there are a number of awards that I have been given by various NGOs or various associations to recognize the work that I have been doing. And very importantly, I have been recognized by the some government institutions. And I am now the member planning committee uh, uh, for promoting tobacco cessation in the Ministry of Health and Family Welfare. And I am also in the Ministry of uh, uh, de-addiction, that for as a member committee, and I have been recently nominated to the uh, what we call National Academy of Medical Sciences. And really it makes a lot of difference. And recently, uh, when we started this oral oncology connect programs, we have been running these programs across and training doctors to for early detection for these cancers. So it's a huge number that I'm reaching out to the people. Thank you so much.
Thank you so much for guiding us. Your publications, your awareness campaigns have been given in various newspapers, and more than 50 articles have been published in the renowned newspapers of India and also in international newspapers. I have seen your articles where you are giving lot of briefing about the tobacco cessations, that how you are opening these tobacco cessations clinic. What is your thought process for the eradication of tobacco in India?
See, yeah, I'll tell you, the important aspect is that yes, there will be uh, tobacco has to be eradicated. Tobacco has to someday be means there has to be a ban on tobacco. That is for sure. But the journey is a little long journey, right? It has been a fight for since we in 1980s when we first got a paper that yes, tobacco is causing a lot of diseases. Since then, it has been a journey for people who are fighting against tobacco, and then people who are promoting tobacco. Right, promoting tobacco is only for commercial interest, but fighting against tobacco is for the health and well-being of the people, of the population, of the society. Right. So we fighting individuals who are looking only for the personal interest versus those who are looking for the interest of the society. So these are the two fight that is going on. And of course, because of the lot many things that is assured, but one of the most important that what we have I have put it as a save the youth campaign. What we do, S is the sensitization, that is school programs and other things where we sensitize. Be smart, do not start. That is what we say out to all the people, all the children who have started not to take tobacco. The second part that we tell is be careful and fearful of people taking tobacco around you. Agar आपके आसपास if some people are taking tobacco around you, please be away from them. Don't be friends to them. Right, that is another part. And the third very important is win over tobacco is easy. Yes, it is possible to quit tobacco. We can, if we go through a medical clinical uh, way of approach, then it is possible to quit tobacco. That is the third message. The fourth message is, of course, the pan masalas that is coming in the societies. That also we need to make sure that we are away from these pan masalas and other things. Right? We should not be taking, because supari, or what we call it as a betel nut, is also causing a major disease in India, and what we call it as submucosal fibrosis. And that is where our Triscare, the mouth opening device, comes in, where I am using this this is the innovative product that I brought in for our patients who have got decrease in the mouth opening. Right? So these are the four major areas. Yeah, this is what we can see, the that four major areas that we have been working. And of course, the other is that we want to create more and more tobacco marshals in the society. more and more tobacco marshals in the society. That is what we want to. So these are some of the things that we are really looking at, and yes, it is making a lot of changes in the society, and that's what is happening. Thank you, Dipti.
Yes, Dr. Pawan, you have given a very good information that what are your future plans of eradication of tobacco from the country. And as an expert, you have given a guidelines that tobacco should be curbed completely in the country and it should not be used by any people. And you are doing a lot of campaign for youths, definitely. Doctor, as an oncologist, as an onco surgeon, I just want to ask you that what are the treatments options available in oncology? What are the different segments we can treat oncology? And in the time of COVID, you have given a virtual trainings to the doctors, to the mass community, to the peer group. How you are able to run this concept of virtually, and you have taken the full usage of artificial intelligence. Uh, because you are a very busy doctor, you are doing the OPDs in three different hospitals of Max, and after that you are conducting the surgeries also. Many times you are doing the robotic surgeries also, because you have seen the version of oncology from the very primitive to the most modernized one. And now you are an innovator for this special gadget, that is the instrument that you have made, Care, which has to be approved by the government of India, WHO, and US FDA. So please give us the information on this.
Yeah. Thank you, Dipti. If I just first go to the Triscare, yes, Triscare is a mouth opening device, and the submucosal fibrosis, which is very very common in all those. See, in India, chewing tobacco is very common, right? So for chewing tobacco, Triscare device has been of great use, or because it helps in slowly mobilization and stretching of the oral cavity, and this fibrosis slowly starts breaking up. So this is a very important thing that is being used for our patients. And if you are looking at modernization of the oncology, yes, we have got a lot of not only surgically there have been a lot of changes that is taking place now. Nowadays, as you would have got, we have started doing 3D planning for our patients, then CAD CAM planning, and then giving scarless surgeries to our patients, right? And this is a very important thing that has started developing, that patients who come up with oral cancers and all, they go back, and if that patient comes and sits with you, you will not be able to know that yes, this patient had oral cancer surgery done, right? So that is the type of reconstruction that we are doing. Scarless surgeries with the visor flap, we are trying to do a surgical resection. These are some of the important aspects that we have taken place. And then besides that, radiotherapy is also a very important aspect, and newer machines have come in for radiotherapy, the chemotherapy, the immunotherapy, and also of course targeted therapy. These are some of the things that we have also started developing. Malab, it is also, Malab, it's now in thing, and patients are benefiting from all these newer developments that has taken place.
Dr. Pavan, you are doing a very wonderful job of screening the patient, giving them psychological treatment, and then screening the patients with your tumor board meetings also, and taking an advice from your other departments also, like medical oncology and radiation oncology, because you are a surgical oncologist, you know your topic very well. So, what is the rationale on having these tumor board meetings in hospitals?
See, tumor board is a what patient. See, ultimate thing is that the best thing to be given to the patient. The patient should get the best benefit of all the treatment. And there are gray areas sometimes. What is going to be the best for these patients. These gray areas maybe whether if surgery should be done first, or maybe should we do uh, chemotherapy first and then go for surgery. So these are some of the gray areas, and these gray areas actually when we sit together, when all the specialties like medical oncologist, surgical oncologist, radiation oncologist, the radiologists, the pathologists, when we all sit together, we may discuss out certain aspects of the patient, which will, and we do a planning for these patients, ki what best treatment can be given to this patient. So at Max Hospital, where I'm working, so this is where we create a means proper planning and through this tumor board discussions, right? And that helps the patient for proper guidance.
Thank you, Dr. Pawan, for guiding us in details about these programs. Now, I just want to ask you, okay, you have done a very good program with Inner Wheel also. That is one of the NGO where you have called thousands of women and guided them and developed them as a marshal. And these type of NGOs and big organizations, some corporates you have tied up for giving them lectures and developing them and training them. Like many corporates also calls you for delivering the lectures. So just tell me ki how we can proceed in these guidelines where we can uh, give our trainings, educations to a mass and community.
Yes. So this is a very important aspect that I started because see, tobacco marshals are like our foot soldiers, and we started one program empowering women against tobacco. Women are the biggest sufferer because of tobacco in the society, right? Whether it is because financial, whether it is because of the husband taking tobacco and they get lot of diseases, and the female has to suffer because of that, all those things. So tobacco empowering women was one of my ideas, and that is where we tied up with Inner Wheel Club, and we started working with them at a bigger level, at the all India level, right? And in almost like 5 months of time, we trained almost 1000 tobacco marshals and mini marshals, and we picked up teachers across various institutions to train them against tobacco and to how to help people quit tobacco, how they can guide people to quit tobacco, right? If person is taking tobacco, they should be able to guide. So tobacco marshal, one of the program that we are leading, and we are having training programs for these people. And also we started a tobacco cessation certificate course, right? This is for the doctors, so that doctors in the periphery, doctors who are uh, they should be able to, at least tobacco cessation centers should be available across India, right? More and more people should be trained, and they should be giving this facility or giving this treatment to the patients. So this is what we started in as our as a capacity building for tobacco cessation and oral care and oral this is what we started with the people, right? And what we are looking at is like setting up network of centers, so that more and more people can get oral care, oral early detection, and also tobacco cessation for these patients. So we are also including new technologies. We are tied up with some IIT Delhi, we are tied up with RRCAT, and we are tied up with some other institutions to bring in new technologies by which we should be able to detect and treat patients at the early stages. So that, and that too, not these patients don't have to travel all the way to the higher centers, but we are trying to make it available at the periphery itself. Right. So through tobacco marshals, to trained doctors, we try to create this type of a networking system. Thank you, Dipti.
In the last, doctor, I just want to ask you what is your message to the community? As an expert head and neck oncosurgeon and the most eminent doctor who is doing lot of work for tobacco cessation pan India as well as in the global market, what is your message?
See, I have got only two messages right now that can come to my mind. Number one is advise quit tobacco. Every person who takes tobacco and you see them taking tobacco, please advise them to quit tobacco and ask them to go to the right center, to the right doctor who is trained to help a person to quit tobacco. That is number one. Number two, my home tobacco free. This is a campaign which we have launched this year, that every person should make their home tobacco free, and the children, the adults, everyone should be tobacco. The maids, the driver, everyone who comes into the house, they should be tobacco free. If we create such small pockets, we will be able to make the entire universe tobacco free. This is my message to everyone, and I hope everyone will take and become a tobacco marshals. Each one of us have to be a tobacco marshals. Thank you so much.
Thank you, Doctor. On the series of World Health Day, you have given us an immense knowledge about the tobacco cessation, tobacco quitting, and developing the Marshalls Pan India. And hope to see you again on this channel, California TV Live Medi Talk Show. Thank you, sir. Thank you so
Thank you so
much.
much. Thank you. Thank you.
Namaskar.